So of course this is the aorta, right? And then branching off the aorta, you may remember that I talked about there being different blood vessels. The first unpaired artery branch off is the celiac trunk, and I was looking for that in the cat and I didn't find it. But the celiac trunk, that's the superior mesenteric, and that's the inferior mesenteric. So again, this is the abdominal aorta, and then these two here, you can know those.
Are you going to open a cat and label it? Or is this strictly...
I'll do some questions on the cat too, yeah. But I do want you to know these two blood vessels here. These are the, right? This is the common iliac artery here, common iliac. And then that's external iliac, internal iliac artery. So common iliac, external iliac, internal iliac. And it becomes the femoral artery. So the external iliac becomes the femoral artery. And then, of course, you should be able to identify the inferior vena cava. What else? And then up here, right? So trachea, and then it branches, producing two what? Primary bronchi. Primary. So primary you should be able to identify, and even the smaller ones are the secondary bronchi. So you should be able to identify the trachea primary and secondary bronchi. And this, of course, is what? Esophagus. Spleen. Thyroid cartilage. Brachiocephalic vein. Superior vena cava. This is the subclavian. That's the right subclavian, left subclavian. Jugular.
Can you show the jugular again?
Here.
Okay.
So both the jugulars and the subclavian branch off the brachiocephalic. This is the brachiocephalic vein. Now, in terms of arteries, there's only one brachiocephalic artery, which gives rise to the right subclavian or the right common carotid. So there's only one brachiocephalic artery, but there's two brachiocephalic veins.
Which one is this one again?
This down here is the femoral. Okay, and again, this is the celiac trunk, superior mesenteric, and inferior mesenteric arteries. Of course, that's the renal artery. These you should know too, right? These going off the side here. These are the well, these are gonadal. They, depending on whether it's a male or a female. I think this one is androgynous, but it's the spermatic or the ovarian artery and vein. So I'll just refer to them as gonadal. Vein and arteries, gonadal vessels. Okay, so let's do the eyeball.